Have you ever noticed that something doesn't come out the way it should? That at the moment when everything should happen, it simply doesn't? You feel all the sensations, your body responds, but when the time comes, nothing, or almost nothing. And then comes that flood of thoughts. Is something wrong with me? Is this normal? Why has nobody ever talked about this? If you're going through this, first, take a deep breath and stay calm. You're not alone. Thousands of men are facing this exact same situation right now, but the vast majority suffer in silence because they simply don't know that this has a name, has a cause, and most importantly, has a solution. Second, there's a real medical explanation for this. It's not in your head, it's not psychological in most cases, and it definitely doesn't mean you're less of a man because of it. The problem is that this subject is still a huge taboo. Men don't talk about it even with their closest friends, much less seek out a doctor. And meanwhile, they spend years carrying an anguish that could be resolved with the right treatment. Today, I'm going to explain clearly and directly what might be happening with your body, what the most common causes of this problem are, how to identify each one, and most importantly, when it's time to stop searching the internet and seek real professional help. Stay with me until the end of this video because I'm going to reveal a cause that catches most men completely off guard, and this information could literally change your life and the way you take care of your health. First of all, for you to understand what might be happening, we need to talk about how things work when everything is normal. The male body has an incredibly complex and well-coordinated system. We're talking about muscles, nerves, glands, ducts, and different structures that need to work in perfect sync, like a well-rehearsed orchestra. Each instrument has its specific function, and when they all play at the right time, the music flows naturally. When everything works well, the process happens automatically. You don't even need to think about it. The brain sends the signals, the muscles contract in the correct sequence, the valves open and close at exactly the right moment, and the final result is what you'd expect. But what happens when one of these instruments goes out of tune? When a muscle doesn't contract as it should, when a nerve doesn't transmit the correct signal, or when there's some obstruction in the way? That's when situations arise where the volume released is very reduced, barely noticeable, or even completely non-existent. And this isn't made up. It's not an exaggeration. This has a name in medicine. When there's no fluid release at all, we call it aspermia. When there's the sensation of climax but without the corresponding release, it could be ejaculatory anorgasmia. They're different conditions with different causes, but both are real, documented, and most importantly, treatable in the vast majority of cases. And here's the data that really concerns me as a healthcare professional. Research shows that the vast majority of men who face this problem take an average of 3 to 5 years to seek medical help. 3 to 5 years suffering in silence. Why? Because of shame about discussing the subject, fear of being judged, lack of information, thinking it's something rare or without a solution, or simply having no idea that effective treatments are available. And while these men wait, the problem that could have been solved simply sometimes gets complicated. A condition that would have been treated with a medication adjustment ends up progressing. A cause that would have been identified with a basic exam goes unnoticed for years. That's exactly why this video exists, to break this cycle of silence and misinformation. Let's start with the first and most common cause of this problem. It has a technical name that you may have never heard, retrograde flow, or in medical terms, retrograde ejaculation. But what exactly happens in the body when this occurs? To understand, you need to know that there's a small muscular valve located at the entrance to the bladder. Under normal conditions, at the exact moment of release, this valve closes automatically. It's like a door that shuts and prevents the fluid from going the wrong way. With this door closed, the only possible path is out of the body. The problem starts when this valve, for some reason, doesn't close as it should. It stays partially open or completely open. And then what happens? The fluid, which should be expelled, finds a path of least resistance and ends up being directed into the bladder instead of exiting the body. The result? You feel all the normal sensations, the climax happens, but nothing or almost nothing is released. The fluid is there, it was produced normally, but it ended up in the wrong place. And what can make this valve stop working correctly? The first cause is surgical procedures. Surgeries in the prostate region are the main culprits, especially transurethral resection, a common procedure for treating an enlarged prostate. Surgeries on the lumbar spine can also affect the nerves that control this valve, and even procedures in the pelvic or abdominal region can have this side effect. The second important cause is diabetes, and this surprises a lot of people. Diabetes, especially when it hasn't been well controlled over the years, can cause progressive damage to the body's nerves. This is what we call diabetic neuropathy. And the nerves that control this bladder valve are especially vulnerable. That's why diabetic men have a significantly higher incidence of this problem. The third cause is specific medications. Some drugs used to treat high blood pressure, mainly those in the alpha blocker class, relax the muscles in this region and can prevent the valve from closing properly. Medications for prostate problems, like tamsulosin, have the same effect, and some antidepressants can also contribute. Now, how do you know if this is what's happening to you? There's a classic sign that's almost like a signature of this condition. Observe your urine right after intimate moments. If it's cloudy with a milky or whitish appearance different from normal, this is a strong indicator that the fluid ended up in the bladder and is being eliminated along with the urine. This sign is so characteristic that many urologists request exactly this test. The patient is instructed to urinate right after climax, and this urine is analyzed in a laboratory. If sperm are found in the sample, the diagnosis of retrograde flow is practically confirmed. The good news? This condition isn't dangerous to your health. The fluid that goes to the bladder is simply eliminated the next time you urinate. It doesn't cause pain, doesn't cause infection, doesn't bring risks. The only real problem is for men who want to have children, since the material isn't being deposited where it should be for natural fertilization to occur. The second possible cause is some type of physical blockage in the system. And for you to understand this simply, I'll use an analogy. Imagine a garden hose. You turn on the faucet, water starts flowing with pressure, but somewhere along the way there's a knot, a bend, or something obstructing the passage. What happens? The water tries to pass through, builds up pressure, but can't get out the other end, or only a weak trickle comes out. Something very similar can happen internally in the male reproductive system. The path that the fluid travels from where it's produced to the exit of the body passes through various narrow ducts and channels. If at any point along this journey there's an obstruction, the fluid simply can't pass through. It's produced normally, the glands work, the muscles contract, but there's a physical barrier preventing exit. And what can cause this type of blockage? First, cysts, small fluid-filled formations that can develop along the ducts. Often they're completely asymptomatic for years, and the person doesn't even know they have them. They only discover it when investigating why normal release isn't happening. Second, calcifications. Over time, especially after 40, small calcium deposits can form in certain structures. It's like a small stone that gradually forms and eventually can partially or totally obstruct the passage. Third, internal scarring. Inflammatory processes, even old ones, can leave scar tissue. And this tissue, unlike normal tissue, is more rigid and can narrow or block the channels. Urinary or genital tract infections, especially if they weren't adequately treated in the past, are common causes of these scars. And fourth, congenital conditions. Some people are born with anatomical variations that only manifest later in life. Ducts narrower than normal, absence of certain structures, or subtle malformations that went unnoticed their whole life. What's different about this cause compared to the others is that there's usually a sensation of pressure or discomfort during the process. The body is trying to expel the fluid, but it has nowhere to go. Some men describe it as a sensation of something stuck or an incomplete and unsatisfying climax. Diagnosing this type of problem requires imaging exams, transrectal ultrasound, pelvic MRI, or even more specific exams may be necessary to visualize exactly where the obstruction is and how large it is. The positive news is that many of these obstructions can be treated with minimally invasive procedures. Modern techniques allow these channels to be unblocked without major surgeries, often in outpatient procedures. The third cause is one of the most complex and is directly related to the nervous system. To understand the importance of nerves in this process, think about this. Absolutely everything that happens in your body during climax is coordinated by electrical signals. The brain is the command center, and it sends precise instructions through the spinal cord and peripheral nerves to the pelvic region. These signals say exactly which muscle should contract, in what order, with what intensity, and for how long. It's an extremely precise neurological choreography that happens in fractions of a second. If any part of this communication system is compromised, the message doesn't arrive correctly, and the final result is affected. It's like a conductor trying to lead an orchestra by phone, but the line has interference. He gives the commands, but the musicians can't hear properly. The result is chaos instead of a harmonious symphony. Several conditions can affect this neurological communication system. Spinal cord injuries are perhaps the most obvious. Accidents, trauma, falls that affect the spine can partially or totally interrupt the transmission of nerve signals. Depending on the height of the injury, different functions are affected, and reproductive function is frequently one of them. Multiple sclerosis is another important condition. In this disease, the immune system attacks the protective layer of the nerves, causing failures in the transmission of electrical impulses. Men with multiple sclerosis frequently report difficulties in this area, and this can even be one of the first symptoms of the disease before diagnosis. Diabetic neuropathy, which we mentioned before, also comes into play here. Chronic diabetes progressively damages peripheral nerves, and the nerves in the pelvic region are particularly vulnerable. That's why adequate blood sugar control is so important. It's not just to avoid problems with the eyes or kidneys, but also to preserve nerve function throughout the body. Surgeries in the pelvic or abdominal region can also cause neurological damage. Procedures to treat prostate cancer, bladder cancer, colorectal cancer, or even vascular surgeries in the abdominal region can inadvertently damage important nerves. Surgeons do their best to preserve these structures, but it's not always possible, especially in cases of more advanced tumors. And finally, some rarer neurological conditions like Parkinson's disease, certain types of hereditary neuropathies, or after effects of infections that affect the nervous system can also be responsible. Treatment for neurological causes is generally more complex and requires a multidisciplinary approach. A neurologist and urologist need to work together, sometimes with the participation of other specialists. Depending on the case, medications that help nerve transmission, stimulation techniques, or adaptations to allow reproductive function when the goal is having children may be indicated. The fourth cause that many men are completely unaware of is hormonal imbalance. And this surprises a lot of people because generally, when we think about male hormones, we think about desire, energy, muscle mass, but the influence goes far beyond that. Hormones are like invisible conductors that govern practically all body functions. They determine the rhythm, intensity, and coordination of processes that you can't even imagine are being chemically controlled. In the specific case of the male reproductive system, several hormones need to be in balance for everything to work well. Testosterone is the most well-known and indeed the most important. It's not only responsible for desire, it directly influences the production of seminal fluid, the function of the glands involved in the process, and even the strength of muscle contractions during climax. When testosterone levels are very low, the entire system works weaker, slower, less efficiently, and one of the possible results is significant reduction or absence of the volume released. But it's not just testosterone. Thyroid hormones also play an important role. Both hypothyroidism, when the thyroid functions less than normal, and hyperthyroidism, when it functions too much, can affect male reproductive function in different ways. The thyroid regulates metabolism throughout the body, and when it's unregulated, the effects cascade to various systems. Prolactin is another hormone that deserves attention. Normally associated with milk production in women, prolactin also exists in men, in smaller quantities. When prolactin levels are elevated in men, a condition called hyperprolactinemia, this can suppress testosterone production and directly affect reproductive function. Benign pituitary tumors are a common cause of elevated prolactin. And speaking of the pituitary, this small gland in the brain is like the general manager of the entire hormonal system. It controls the thyroid, controls the adrenal glands, controls testosterone production. If there's any problem with the pituitary, whether a tumor, an injury, or an autoimmune condition, the domino effect reaches the entire body. How do you identify if hormones are the cause of your problem? There are usually other associated symptoms. Constant fatigue that doesn't improve even with adequate sleep. Decreased desire that goes beyond what's normal for your age. Difficulty with concentration and memory. Mood changes with a tendency toward irritability or sadness for no apparent reason. Loss of muscle mass even while maintaining physical activity. Increased body fat, especially in the abdominal region. If you identified with several of these symptoms in addition to the main problem that brought you to this video, it's very worthwhile to investigate the hormonal aspect. And the good news is that diagnosis is simple. Basic blood tests can measure total and free testosterone levels, TSH and T4, to evaluate the thyroid, prolactin, and other relevant markers. Based on these results, the doctor can identify if there's an imbalance and the best way to correct it. Hormonal treatment, when well indicated and well monitored, usually brings significant results in a few weeks or months. And now we come to the cause I mentioned at the beginning of the video, the one that catches most people completely off guard: medications. Pay attention to this information because it's extremely important, and unfortunately, many doctors don't adequately warn their patients about this side effect. Several commonly used medications, the kind that millions of people take every day, can directly affect the release of seminal fluid. And the worst part, often the person starts taking the medication, notices something changed, but doesn't even make the connection between one thing and the other. They think it's stress, they think it's age, they think it's a relationship problem, and they continue suffering without understanding the true cause. Let's go through the main groups of medications that can have this effect. First, antidepressants, especially those in the class called SSRIs, or selective serotonin reuptake inhibitors. We're talking about very commonly prescribed medications like fluoxetine, sertraline, paroxetine, escitalopram, among others. These drugs alter the way the brain processes serotonin, and one of the most common side effects is precisely difficulty with reproductive function. This can manifest as delayed climax, difficulty reaching climax, or reduction and absence of released fluid. Studies show that up to 60% of men who use these medications report some type of change in this area. Second, high blood pressure medications. Alpha blockers are the main culprits here. They work by relaxing the blood vessel muscles to facilitate blood flow, but they also relax that bladder valve we discussed earlier. The result is the retrograde flow I explained at the beginning. Medications like doxazosin and tamsulosin are classic examples. Third, specific medications for prostate problems. Finasteride and dutasteride, used to treat enlarged prostate or even hair loss, can significantly affect the volume released. They work by blocking the conversion of testosterone to its more potent form, and this has a direct impact on the glands that produce seminal fluid. Fourth, some antipsychotics. Medications used to treat conditions like schizophrenia, bipolar disorder, or even some cases of severe depression can elevate prolactin levels in the body, causing the effects I mentioned when talking about hormones. And fifth, some other less obvious medications, certain muscle relaxants, some anticonvulsants, certain medications for chronic pain, and even excessive use of anti-inflammatory drugs can contribute. Now, if you're hearing this and thinking, I take one of these medications and I really did start noticing this problem after I started the treatment, calm down. Don't do anything hasty. The worst thing you can do is stop taking your medication on your own. This can be dangerous, especially in the case of antidepressants, blood pressure medications, or medications for heart conditions. Abrupt discontinuation can cause serious side effects, worsening of the original condition, and other serious problems. What you should do is schedule an appointment with the doctor who prescribed the medication and have an honest conversation about what's happening. Explain the symptoms you're noticing, ask if there could be a connection to the medication, and discuss available alternatives. Often there are other medication options in the same class that have less effect on this area, or the doctor can adjust the dosage, or they can add another medication that helps counterbalance the side effect. Solutions exist, but they need to be discussed and implemented with medical supervision. Now, when should you really see a doctor? If this happens suddenly, without apparent explanation, it's an important warning sign. Sudden changes in body function always deserve investigation. If it's accompanied by pain, discomfort, burning, or any other symptom besides the absence of fluid, the search for help should be even more urgent. If it's affecting your plans to have children, don't wait. Time is an important factor when talking about fertility, and the sooner you start investigating, the more options you'll have available. And if it's causing significant emotional impact on your well-being, your self-esteem, or your relationship, that's also sufficient reason to seek help. Mental health and physical health are completely interconnected. The right professional to evaluate this type of situation is a urologist. They're the specialist who understands the male reproductive system and has the tools to investigate correctly. During the consultation, they'll evaluate your health history, ask about medications you're using, order specific tests, and determine the exact cause of the problem. And here's an important truth I want you to remember. The sooner you seek help, the easier treatment tends to be. Problems identified early generally have simpler solutions and better outcomes. The good news I want to leave you with is that in the vast majority of cases, yes, treatment exists. Depending on the identified cause, there are various options. When medications are responsible, often simply switching or adjusting the medication completely resolves the problem. It's the simplest and fastest solution when it applies. For cases of retrograde flow, there are specific medications that help strengthen the tone of that muscular valve we mentioned. They don't work for everyone, but for many patients, they bring significant improvement. When the problem is hormonal, replacement or regulation of the altered hormones can make all the difference. Treatment is done with regular monitoring and dose adjustments until finding the ideal balance for each person. In cases of physical obstruction, minimally invasive procedures can clear the pathway. Many of these interventions are done in an outpatient setting, without the need for hospitalization, with quick recovery. And for men who want to have children, even when the problem can't be completely reversed, assisted reproduction techniques exist. In the case of retrograde flow, for example, it's possible to recover the material from urine after climax and use it in fertilization procedures. Reproductive medicine has advanced greatly and offers paths for practically all situations. The important thing is to understand that you don't have to live with this in silence. You don't have to accept it as something inevitable. You don't have to suffer alone thinking there's no solution. Before finishing, I want to debunk some myths that still surround this subject. First myth: this means I'm not a man anymore. Completely false. This is a medical condition, just like high blood pressure, diabetes, or any other health problem. It doesn't define who you are, doesn't diminish your worth, doesn't affect your masculinity. It's simply something happening in your body that can be treated. Second myth: there's no solution, I'll have to live with this forever. False in the vast majority of cases. As you saw throughout this video, treatments exist for practically all causes. Some are simpler to resolve, others more complex, but rarely is the situation irreversible. Third myth: it's just an age thing, it's normal when you get older. Not always. Although some changes in volume and intensity can occur with natural aging, complete or near complete absence of fluid is not a normal consequence of age. It can happen at any stage of adult life and always deserves investigation. Fourth myth: if it doesn't hurt, it's not serious. I don't need to worry. Not necessarily. Many serious conditions don't cause pain at first. The absence of pain doesn't mean the absence of a problem. Even without physical discomfort, it's worth investigating to understand what's happening and treat it if necessary. If you've made it this far, you're already well ahead of most people. Knowledge is the first step to taking care of your health, and you just took that step. If this content was helpful to you, leave a like to help the algorithm show this video to other men who also need this information. Subscribe to the channel if you're not already subscribed, and turn on notifications so you don't miss the next videos about men's health. And if you know someone who might be going through this, a friend, a family member, someone close, share this video. Sometimes we don't have the courage to ask about certain things, but if the information arrives another way, it can make all the difference. A simple share can change someone's life. Remember, taking care of your health isn't weakness, it's intelligence, it's responsibility to yourself, it's self-love. See you in the next video.